When Headwaters Foundation was created, we actually went around the western half of the state to ask communities what they thought we should invest in. We said, hey, if you had a new foundation that had a $100 million endowment, what do you think we should do to improve the health of our communities? And what we heard over and over again was that we should invest in kids in their earliest years.
0 to 5 is an initiative that we do in our community. It's brought to us by the Headwaters Foundation. This initiative really focuses on bringing community partners together. And part of that is really looking at how we set up strong early learning centers like Pete's Place.
What we do as 0 to 5 Montana is really help to look at the entire early childhood system and all the things that families need to be able to make sure their kids are healthy and their kids are set up for not only their day-to-day, but set up for their future.
To really try to solve the problems before they start. And that we should do that by looking at local communities who know the solutions. They know what it takes to really support kids and families in their communities to improve their health.
So we're not here to be the knowledge experts, but we're really here to bring the knowledge experts together. So yes, we are more of that community hub to bring the key stakeholders together and really figure out what we need to do.
St. Pete's has been an excellent organization that's really thinking about how they can build broad community partnerships. It's the only 0 to 5 collaborative that we have housed at a health institution. So St. Pete's has been really forward thinking and thinking about how they can bring community services that are going to improve the health of their patients outside of the hospital walls.
It's critical that we really think about how we support kids now and knowing that we're setting them up for their future. Those first 5 years of life are so critical when it comes to brain development, and those relationships, those interactions that kids have with their parents or primary caregivers in their lives is really what's the foundation of what's setting them up for the whole rest of their lives.
The first teacher is their parent, and then their second teacher is the environment, and then the third is the teacher, and the teacher goes behind and extends and simplifies their education and their development according to it. So providing all those materials and engaging in different developmental areas helps that growth process.
I think it's worth it because we have patients and families who definitely need that support, and I don't know that they would get it otherwise if we weren't here to connect with them and to provide support.
I think that's like what's so critical about all these investments in early childhood is that you don't always see the benefits right away, but you do down the road.
Study after study has indicated that if we set this area up for success, you can really help to avoid those chronic disease states.
Tiny little things can make a huge difference in the overall health and happiness of mom and baby. A little vitamin deficiency starting in prenatal care can persist throughout childhood and cause significant bone abnormalities, developmental delay, speech delay, and problems for the kid lifelong that could be easily fixed with one vitamin in mom.
It's for our children to grow and to be successful throughout their lifetime. That's who we're going to be, the doctors and nurses in the future.
I truly feel like I've come full circle in my work, working with those families 20 years ago and identifying families who maybe had some of these needs, but maybe there wasn't a program like this that was helpful in identifying those needs, and certainly not someone dedicated to making sure that those families were connected. So I feel like in that way, those early interventions and getting families connected as early as possible to supportive resources is making an impact for a lot of families and a lot of children, for sure.
Focusing on them at a young age is super important because of the benefits that it yields over time. It's the old analogy, young trees bend, right? Old trees not so much. And so this idea that we have an opportunity to make a difference and an influence in their lives at a young age, help them develop, prepare for school so they can be successful in life, is just part of our commitment at St. Peter's Health and with our population health team and the focus that we have on can we start really, really early so we can prevent things that might later on come our way. And I think the 0 to 5 initiative is one of those, right?
Investing early, investing in prevention really is the smartest investment that we can make when it comes to the health of our communities.